So sadly, we have to report two more Albany County residents passed away last night. A man in his 80s and a woman in her 80s. And there was one death reported yesterday, a woman in her 50s. My condolences and prayers go out to all three families. And again, it's a difficult time to lose anyone to COVID-19, but in these difficult times to say goodbye to someone in the ways we used to. So please take a time to take a step back today and really think about these families in the 194 families this is unfortunately has happened to. It's tough times. As of today, there's 9,284 cases of COVID-19 in Albany County. That's an increase of 221 positive cases since yesterday. The day before that, we saw an increase of 161, which we probably figured was being closed down on Thursday from the snowstorm. So that number dropped down. The day before that was 178. So unfortunately, Dr. Whalen and I were correct. We're going to be well above 200, especially with Christmas upon us and other holidays. There are currently 3,197 people under mandatory quarantine. Of those, 28 have had close contact to a positive case. 5 were healthcare workers at a resident or group setting. 188 don't have a clear source of infection at this time. Over the last 5 days, there's been an average of 200.4 new positive cases each day. The day before that, it was 197.2. As of today, 31,518 people have now completed quarantine, which is also good. So we do try to put the positive stuff out with the other information that we get. I know it's a lot of feedback we get on Facebook about that and other questions directly at my office. Look, we just got to put the facts out as we see them to let people understand where we're headed, what direction we're in. And yes, people do recover from this, which is awesome, even before the vaccine. So we have now, though, out of those, 7,679 tested positive for the virus had recovered. 216 recovered since yesterday, which is good. The other alarming thing is, though, we're seeing the record amount of people go into the hospital. We had 14 new people administered into the hospital, and again, it's that numbers we have to watch. People go in, people come out, but it's alarming the amount of numbers. There are now 113 people currently in the hospital. Yesterday it was 114, so we're down 1, which is good, but it's still one of the highest as we have had since this virus started 9 months ago. Is having 113 people in the hospital. So we have to watch that since the outbreak of this started. The governor released the state's hospitalizations number on Saturday that showed the highest number of New Yorkers hospitalized since May 15th, which is concerning. So we are seeing that hospitalization for whatever reason. The way this virus is hitting everyone 9 months later, we're seeing more hospitalization, more people in ICU, more beds being used up, and it's alarming. Even though the vaccine's here, I tell people they got to be patient. We're going to get there, but it's going to take time. And you got to remember, when you get your first shot, it's 3 weeks till you get your second shot. So it's about 6 weeks before you know what type of effect the vaccine's going to have. 21 patients are currently in the ICU. Yesterday it was 21. So, and the day before that was 22. So down 1 from 2 days ago, but still our ICUs are at the highest they've ever been. We continue to monitor the Capital Region's hospital capacity. Like I said, Dr. Venditti is going to be on our control room tomorrow at 1400 to talk about the partnerships and the meetings they're having with all the hospitals in the region, how they can ship patients around if they get to a crucial tipping point where these beds start to get harder and harder to get in hospitals like Albany Med or St. Peter's. So right now, our hospital bed space has been stable at 24% or 25%, while our ICU beds space is now down to 30%. It was at 35 a week ago, so we dropped down about 5% for that. When I last reported it on Saturday, we continue to urge people, please wear a mask, socially distance, cough into your hands, or your arms, your elbow, clean your hands, and we're going to get through this, but we need to be in it together in a partnership. So this will help us turn our numbers around if we continue to do the right thing. So everyone out there doing the right thing, thank you. I appreciate it. I know it's difficult, especially with the holidays, and who would have thought 9 months later, here we are, right? Actually, yeah, over 9 months now. So again, I know it's tough. So please continue to do this, and we'll get through it. If it's possible, get tested. Even if you don't have signs and symptoms, we're encouraging everyone to get tested that can. And the other issue that we've had, and we've talked about this today, before, people come out negative in the beginning. I brought up that girl, Jenny, who quarantined because her brother got it. So she had a quarantine for 14 days. 3 days before her quarantine ended, and she got tested beforehand, she was negative. She was positive, at the end. And I'm like, sorry, it's another 14 days. You got to stay in. I mean, it doesn't start from when you first start. It starts when you get your negative test. That's when your 14 days starts. Even the people that are doing the right thing. So that's like 28 days almost, where she has to self-quarantine. Not easy. I get it. I really do. Some good news today. I went out to the nursing home this morning when they delivered our first vaccines coming to our residents there. So it was awesome. Walgreen was out there on time and delivering this first shot to our residents. And I have reported before, our workers were not going to get the shots for some reason because we couldn't get enough vaccines. But they have delivered enough where we can get some of them done. And, we have roughly about 172 residents out at our nursing home. 150 have agreed to take the shots. The other 22 either have not or they have healthcare proxies, and we have to get a hold of the people that can make that decision for them. We have roughly over 200 workers. Out of that, we've had 100 agree to take the shot. Other ones are waiting to see whether or not they want to take it or not. So, which is good. Again, it shows that we have to even educate our own workers and our healthcare workers that are on the front lines. And we have to get everyone to understand that this is the way we're going to get out of it, is by getting everyone the vaccine. And slowly we can get rid of the mask and have to socially distancing. But again, it's going to take time to get there. But I do want to say to the residents and workers, thank you for everything that you're doing. I can't appreciate enough what you're doing. So again, thank you. And so we also, unfortunately, we saw the agreement got hammered out by our leaders in Congress last night for the roughly $900 billion COVID relief package. Obviously, I have mixed feelings about it. It's something that I want to say to NISAC, Steve Aquario, Matt Chase from NACO, Mike Griffin from County Executives of America. We hammered out and kept hammering out, and I spent my whole Easter, we literally were on the phone for 18 hours trying to hammer it out, trying to get relief to the counties and towns and villages and cities. And it worked, but then the package stalled. And literally the package that they're passing now is the same one from the summertime that Mitch McConnell came up with. They critiqued some of it, and I want to say this, we're still reading through it all. We're still trying to figure out all the small print and all the add-ons that they like to do, so we don't exactly know where everything's at. I just had meetings with them 3 respective gentlemen this morning, talking about, actually real early this morning, talking about how this is really going to affect us going forward. But some of the things we did figure out was it's a weekly increase of $300 for unemployment benefits, a relief check of $600 for lower income Americans, nearly $300 billion for paycheck protection programs for businesses to keep their workers on board, which is good, funding for additional testing and vaccine delivery, and billions for schools and colleges. I know the sticking point for some of the schools was the private school aspect. I don't know where that ended up working out. I know that the Senate Republicans wanted to give $5 billion to private schools. The Dems did not. So I don't know exactly where that came out in the wash, so to speak. And funding for performance venues like our Times Union Center, Palace Theater, the Egg that we've been advocating for, went on, so they're going to have funding in this. Airports are getting a second bailout. They're going to be getting more money in this too, on top of the $15 billion, so which is good. And some of the other stuff besides what was in this package, we found, early on we got like a $900,000 check from the federal government for our nursing home. I think we're going to get another one roughly in the same area, but this is separate from the bill. So, but I do like to thank Congress for what they've done, but we need more. It's what I talked about early on. I had this feeling, I said this back in April when we got the last stimulus package, that basically I wasn't banking on anything till March of 2021 until we get a new president. So till the president takes over and gets everything in play, we're probably the earliest looking at for the relief that the state of New York needs, the governor needs, and the counties and cities and villages is then That's why I made the conscious decision to give an early incentive to let workers retire or leave service, cut our workforce, trimmed all the departments that I could, and delivered a balanced budget without waiting on this relief, because I knew then we weren't going to get what we needed. So hopefully we get it for next year, because things, a lot of state and federal programs are based on this stimulus package. As we know, the state of New York's probably roughly $24 billion in the hole, $12 billion with MTA, and the other 16 or 15, caused by this virus, or 6.7 before the virus, and then after that. So these are challenging times for the state, and unfortunately, they have a habit of pushing things down to us on the county level. So we have to be wary of that, and it's going to affect our program. So I just talked to Chairman Joyce the other day about this, that it's going to be difficult decisions we are going to have to make mid-shift during the budget process if the state decides to push more stuff down to us. So I want to remind people, you can't tax your way out of this. But the issue is that if we do raise taxes and you go above the 2% cap, some of the things a lot of people did not read when the Senate and Assembly passed this last year was that if we go over the cap, we lose funding for Raise the Age, no bail bond, all that stuff. It's tied in. Our cap on Medicaid, which is about $28 million, we lose all that. So if I go over the cap to plug this hole that could be caused by the state government, okay, then I have to plug the hole of all these other things that they're going to take away. So it's going to be tough decisions. I'm hoping that the Biden administration and Harris administration do the right thing and get this relief package, but our budget, our state budget, as you know, is due April 1st. So these are things that we have to stay on top of and work with, and it would be challenging. So I'm hoping that President-elect Joe Biden and his team start working on this package deal, and the House and Senate do the right thing. And again, this isn't about party affiliation. This is just about getting the relief that people need to continue to move forward. So please do the right thing so we get through it. So because of Christmas, we're going to be slightly adjusting our schedules for testing sites with the Whitney Young testing. Again, will be available at the Times Union Center on Monday and Thursday this week. On Wednesday, the Whitney Young Waterville Administration Building will be doing it. Testing requirements and appointments for the Whitney Young, if you don't have insurance, and I'll say this because I still have people say they can't afford it, please go to UAlbany. It's free. We're free if you don't have insurance, and what you pay for the most part is whatever your copay is. And I haven't heard that if it doesn't cover it or does not. But the number is 518-465-4771, and then UAlbany, as always, 188-364-3065, and Price Chopper, CVS, Priority One, Walgreens, CVS, Urgent Care. I could go on and on and on. Please go to albanycounty.com and you will see the times. They're there. It's a click away. I know you got to be patient. I know there was a shortage of the rapid testing. That was the answer we got back. There's so many people were using it in other areas of this country that they had a shortage of that. Now they're starting to get that back on, and you'll see these places back up and running with the rapid testing. As always, please remember mental health support's available 7 days a week, 8 a.m. to 5 p.m., and that number is 518-269-6634. Our 24-hour sexual assault hotline number, as always, 518-447-7716, and our 211 in our New York State hotline. Look, we've gotten a lot of calls about shutting down. We talked to people. I know under the old matrix, we would be in the red zone and we would have been closed in a lot of areas. I said this at the beginning of December, knowing what we were going into. We have less than 48% of the workers here in the county working. We have essential services we have to deliver. It doesn't matter what's going on in the world around us. We're under federal and state guidelines that we have to deliver. And that's like HEAP or food assistance or housing assistance, unemployment assistance. And children, youth, and family are dealing with kids for placement for neglect or foster kids or whatever it may be, mental health for children and adults. We can't just shut down and them agencies. So we have scaled back, and we'll continue to scale back them operations. I said to the downtown business owners, to anyone that can, please scale back, go back down, slow it down, help us slow this virus down, because if we don't slow it down, the vaccine's not going to be here for a while. Not everyone's going to have an opportunity to go get a shot. I've seen the way it's going to be rolled out, and the way it's going to be rolled out, it's going to take some time. It's going to take time to get to the people that that are under age 65 to begin with. It's going to take time to get to different age groups. You're like phase 5. If you're healthy, and you're at phase 5 of this. It goes phase 1, 2, 3, and 4, and then 5. So that's why I kept saying, I am not trying to deliver bad news. We're looking at September before we get back to some type of normalcy by the time this rolls out. And it's going to be banked on how many people decide to get the vaccine. So if we don't do a better job educating people and getting that message out, and people decide not to get it, it's going to stay here. And what's scary is I'm looking at that new strand that's happening in the UK. As this continues to morph and go around the world, are we going to be fighting this for some time? I don't know. But please remember, it's a marathon, not a sprint. We're going to get through this. We will get through this. We're resilient, and please work together in a partnership to solve the problems. Let's not create them. And if you got answers to the problems, by all means, call my office, 518-447-7040. Email us, Facebook us, whatever you want to do, and we're in it together. So if we're doing something wrong, or you see something that could be right, great. I'm not going to argue the science. I'll leave that to the CDC, the World Health Organizations, all the health experts that do this, and we just take guidance from them. So again, let's roll up our sleeves and work together. Please be safe, wear your mask, stay healthy.